Hello ladies, it's Menopause Barbie here today. And you know, I've been teaching you about different options for managing your menopause your way. Well, one of those options is hypnosis. And so today I am with a hypnotist. This is TC Lenormand, and he is going to interview with me to teach you some things about what he can do to help you manage your menopause in your life. Thank you, TC.
You're welcome, Barbie. I'm glad to be here.
So, you are a certified consulting hypnotist.
Correct.
What does that mean?
Well, a consulting hypnotist, in contrast to, for instance, perhaps a hypnotherapist or a psychotherapist, will work in a more specific area and will not necessarily involve counseling or therapy. I work in a very particular area.
Okay, and you have told me that you pretty much specialize in stress and anxiety. I mean, how many of us don't have stress and anxiety?
Gravity.
I mean, it's like
gravity on us is stressful. So yes, I work in a great capacity with stress management and the other things that you would expect a hypnotist to do. Obviously, weight loss, smoking cessation, fear of flying, things like this. But stress management in the last maybe 10 years has become a primary focus of mine.
And what made you want to become a hypnotist?
Personal interest. Initially, I was really interested in the topic. Was and continue to be deeply interested in personal development. And so started off with that, and then as oftentimes hobby or interest became a passion, and 30-something years later, here I am.
It's always 30 years later.
30-something.
They just went by in a flash.
Yeah.
And do you see a lot of middle-aged women who come in for stress and anxiety?
I do. In fact, I would say the greater amount of my practice is women, specifically, and from the ages of 30 to 60. So
a lot of them are probably menopausal or perimenopausal.
Perhaps, obviously I don't treat menopause, nor would I diagnose menopause. After speaking with you, I'm discovering that perhaps a good portion of the women that I work with may be indeed menopausal.
You just found out that you are a menopause practitioner. You didn't even know it.
Well, much to my surprise. The circumstances around stress, usually people are not even aware that they're experiencing stress until symptoms start showing up. Because our body will take care of it until it's no longer able to do so.
So true. So true.
Hypnosis can be extremely beneficial for all issues associated with stress. Some of the things people come in with regards to what they consider to be stress might be other things, like perhaps depression. So you want to make certain that's not there first, and I will occasionally request that they go get that checked out first to make certain that it's not a diagnosed
that's
depression.
only proper.
But, healthy people, happy people, fully functioning people deal with issues associated with stress. And so I find that hypnosis can be very beneficial.
And when you get a new patient, do you find that their impression of hypnosis is accurate, or do you feel like they mostly have stereotypical and ideas of what it should be, or misconceptions about what it is or what it can do? Is there a lot of surprise in terms of what actually happens in a hypnotherapy or hypnosis session for them?
Yes.
Yeah.
The very first time I see a client, they are usually completely unaware of what hypnosis is about.
Really?
Or they've seen it on stage, or they've seen it in a movie. Or, a particularly favorite of mine is what they say, the superstition of what they say. So yes,
they say this and they say that.
Someone told me that hypnosis is like this.
Right.
So yes, most people, the very first time they were hypnotized, said that they did not think they were hypnotized.
Oh.
It's a very common response because of what the expectation is. And, they're not asleep, although they expect to be asleep. They're completely alert, although they expect to not be alert. Sometimes there's great relaxation. Sometimes they are a bit more catalytic. So
really? Yeah.
So yeah, I would say usually people learn that hypnosis is not what they thought it was.
How interesting. And after they've been hypnotized, what's the most common comment that you get from people afterward? Do they just say that was...
I've never been that relaxed.
Really? It's the relaxation.
It's the relaxation. In fact, I'd like to create a definition for you that I think accurately depicts hypnosis. Hypnosis is the application of suggestion in trance.
Yeah.
Trance is any time the greater amount of your available attention, which fluctuates like your blood pressure, is turned more internally than it is externally.
Okay.
That's not a big jump. That's like daydreaming.
Yeah.
Suggestion is any communication that slips to the side of the critical faculty of your mind. It just slips right through.
Okay.
Suggestion.
Yeah. And I shake your hand automatically without you having to say anything. It's kind of a reflex. It's an automatic response.
All social ritual have their roots in trance and suggestion. There was a little trance there. There was a little suggestion. Are you from the South?
I don't know where I'm from.
Well, you've been all over. But
I'm very confused. I've lived on every continent except Antarctica.
Well, we're a really polite group here. We're really
absolutely
polite. And perhaps you sneezed or you heard someone sneeze, and then a complete stranger yells out, "Bless you!"
Yeah.
Suggestion.
Yeah.
You yawned when somebody else yawned.
Yeah, absolutely.
So we're accustomed to doing the state. We're accustomed to responding to suggestion.
Yeah.
The odd part is doing it strategically.
So
you could think of it like strategic daydreaming. And
well, that's a great term, strategic daydreaming.
And I'm like a docent in a museum. I know the territory well, and I guide them.
That's great. Yeah. That's great. Now, can anybody be hypnotized, or are there?
I would say yes. Obviously, there would be some distinctions that would be made a little bit too much to go into in the course of this conversation, but every reasonably intelligent, sane individual who is motivated to be hypnotized, who is comfortable with the hypnotist. I mean, you don't have to just love me, but you need to not dislike me.
Yeah.
Can experience hypnosis because you do it all the time. You're just not accustomed to doing it strategically.
So what I took from that was the keyword motivated, because I think of that as a willingness. You have to be willing to go into that trance state or that state of subconscious that allows you to be receptive to suggestion.
Yeah, you have to participate. I mean, most people come into an environment like this with the already listening of what you see on stage.
Yeah.
What you see on stage
magic acts
suggests that the individual is doing something against their will. And they are not.
Okay.
Not even on stage. So when people come to see me, usually they are really motivated.
Yeah.
They have deep interest in change. And so that's paramount. It has to be there.
That's important.
And hypnosis or doing the state follows the same continuum that anything else that we learn to do.
Yeah.
Some people are gifted and talented.
Yeah.
Other people have to learn, and it involves being taught.
Yeah.
And so there is a learning curve. The thing that you see on stage, and what people typically associate with hypnosis, those are the gifted, talented group. Those are the people who do not have to be taught how to do the state. They already know how to do it. The rest of us learn.
I see.
But we can learn.
We can learn it.
We can learn it. Yeah.
And in doing hypnosis for stress and anxiety, does it work well? I mean, is it an effective treatment?
That is one area that it can be dynamically effective for a great deal of people.
Wow.
For instance, when someone comes to see me for, say, smoking cessation,
right,
there often is a degree of conflict. There's a part of them that really doesn't want
the part that loves being a smoker and loves their cigarettes.
Right. In fact, they'll say,
I
really don't want to quit smoking, but I know that I should. So there is some blended motivation.
Yeah.
Typically when people come in for stress and they want to be more relaxed, they want to sleep better, or they want to feel more comfortable in some endeavor that they're doing,
Yeah.
they're motivated to do it.
Sure. Sure.
So there again, the motivation part comes in. It's been my experience that everyone who is a suitable candidate, in other words, that they're not actually experiencing undiagnosed depression, which
Yeah.
I would encourage them to investigate first.
Sure.
Most people can benefit from stress management.
I would think. I mean, who wouldn't benefit from something like that? I mean,
Yes,
it's to me, I think it seems logical that almost anyone could see positive results.
Yeah, and truthfully, some of the way that it is beneficial is beyond just teaching a person to relax, which
Yeah.
I will do,
Yeah.
but helping them to process information in a slightly different way.
Yeah.
And part of that is recognizing that we are the ones that are doing it.
Right.
It's not happening to us.
Right.
Stress
So
does not
true.
happen to us.
Yeah, well, we create our own. We create our own drama, don't
Yeah.
we?
Yeah.
So, what determines whether or not hypnosis is going to work for stress and anxiety? What's the most important determining factor?
Their desire
Okay.
and their willingness to learn,
Yeah.
how coachable they are,
Yeah.
and they need to see me enough.
Sure.
Again, this perception of finger snapping.
Ha.
and people,
Everybody thinks of this finger snapping as part of hypnosis.
there's no finger snapping in this office.
What about the pendulum? Is there the pendulum?
I have one in my drawer.
You do?
I have a pendulum. I have a pocket watch. I even have a hypnodish.
Oh.
I even have a hypnodisc.
Do you use them with everybody, or
I
just
never use it.
You never use them?
It's only in there in case someone insists that
Really?
it be there. In other words, if I'm kind of making a joke, but if it's not hypnosis unless there's the pocket
Exactly,
watch, well, then
exactly.
Heck, I have it.
Oh my God! Oh my God! That's very
But
interesting.
mostly I just talk to
Yeah.
people.
Are there women who are just not good candidates for a particular reason, and what's the reason if so?
Well, again, if there's some underlying depression, if there's depression there, hypnosis, despite, I've heard people talk about using it. I've certainly heard that, but I don't think it's indicated. I think cognitive behavioral therapy is the way to go. If the therapist who is doing that happens to have some background in hypnosis.
I see. They might do it in conjunction with it, but in the hands and
perhaps,
under the.
But generally I would say no. So that would be one. The other areas would be, are they healthy enough to undergo it?
Yeah.
Although I have to say I've worked with people in wheelchairs. I've worked with blind people. I've worked with all manner of.
Oh, well, that doesn't interfere with daydreaming.
Not at all. No, it does not.
Now, as I think about this, I'm thinking, okay, if you're really stressed and very anxious, it seems to me that it might be more difficult to be hypnotized because of your stress and anxiety. I mean, people aren't at ease. They're not relaxed when they're stressed or anxious.
That's true.
So
Well, that's where the skill comes in.
yeah, so it's surprising to me that it works so well because of the nature of the problem.
Well, as we talked right before we began, I'm not going to do an induction. So I'm not going to demonstrate anything here, but it is very
I'll be sitting here and suddenly going, oh yes, let me tell you about my past.
None of that. It's all language driven.
Okay.
And so,
Okay.
in the course of a session, and I have to actually attend to me not generating these language patterns in front of you because this is the room where I do my work. And so
Oh, so you automatically.
Yeah, I'm like a trained, one of those Pekingese in the circus, they do that thing.
It's operant conditioning.
Yes.
You come into the room and you
That
start
is
doing your
correct.
hypnobabble.
That's exactly right. Well, there's a sign on the wall. It says quiet, hypnosis in session. So in here, it's about hypnosis, but it has to do with language.
Yeah.
And so regardless if a person is stressed, anxious, really uptight, all they have to do is listen
I see.
All they have to do is be willing and listen to me,
Yeah.
and we will have what seems to be a conversation. And in
Yeah.
the course of the conversation, I will actually hypnotize them.
Yeah. So
Multiple
they don't
times.
realize when it actually happens? So
Well,
you're
the
just starting to
first couple of
talk and then
times-
suddenly you know that they're hypnotized, but they don't.
Well, let's define a little bit about what hypnosis is again.
Yeah.
Hypnosis is when the greater amount of our attention
Yeah.
or incremental degrees of our attention begins to turn inward.
Right.
For instance, tell me when you can see a house in your mind,
Okay, I see.
No,
I
a
see how that
tree.
works. Okay.
a person.
Okay.
And so
Yeah.
that's an example. You have to go inside to make these pictures.
Okay.
What if somebody could create language on the fly that
Yeah.
seemed very casual, but in the course of that language grabbed your attention and imagination to the extent
Yeah.
that it had you become more deeply engaged in your internal dialogue
Yeah.
than what they
Then
were
what's going
saying.
on outside the world?
And that's trance.
Yeah. Yeah. That's interesting.
Again,
Yeah.
this is more of an Ericksonian approach, a
Yeah.
more indirect approach to it. So,
Yeah.
I mean, there is nothing taking place against anyone's will.
Right.
You know,
Right.
but there is a sign on the door. It says hypnosis.
Yeah.
Everyone agrees when they come in the room. We're doing hypnosis.
Okay.
And so, to
Kind of
answer
puts them in a state of mind just by passing the threshold
to
of
a
the door,
certain
right?
degree, yeah. And you know,
Yeah.
just to know that I'm a hypnotist.
Uh-huh.
But to answer your question, how it is that someone could be really anxious
Yeah.
and still be able to do the state,
Yeah.
all they have to do is listen, be willing, and usually maybe 20 minutes in the conversation,
Yeah.
you know, I'll ask them, how are you feeling? Much more relaxed. I'm
Yeah.
feeling much more relaxed.
Yeah. Now, do you ever meet people and think, I would love to hypnotize that person?
Do I? No.
Yeah, you never meet somebody
No.
who you just think,
No,
that'd be a
no.
perfect candidate.
No.
Oh,
no, no,
interesting.
Now, what I do hear, and I usually keep what I do quiet unless it's just somebody says, hey, you know, TC the hypnotist. You know, that says, you know, well, you know, don't look into my eyes.
Yeah, yeah, yeah.
Or don't hypnotize me. I have no
Superpowers.
interest in hypnotizing you. I mean, I
I
want
see.
what you want.
Yeah, yeah.
You know, if you want to be hypnotized, call me at my office.
You're not a
and come-
spooky guy.
Not a, well, I don't think I am. Do I seem spooky?
I don't think you're spooky at all.
Good.
Now, are there any risks? I mean, is there anything that can go wrong or be harmful about hypnosis that you know of?
Well, again, undiagnosed depression.
Yeah.
You know, and the reason why I say that is, let's say that someone comes in and they are having issues with insomnia. They can't sleep.
Right. That's a very common menopausal symptom, by the way.
It could also be
Yeah.
associated with depression. So
Right.
I want to make certain. They
Right.
come in, well, I'm not feeling very motivated.
Right.
All symptoms of
Also
depression.
possibly, yeah.
Or I'm not feeling very positive, or I'm moody, or I'm having issues.
Yeah,
You know, all
yeah.
of these sort of issues. So, you know, baby hypnotist. Are you familiar with that term? Like a baby lawyer? People who haven't been doing it very long. They-
We don't have that term. I've never heard baby lawyer.
You haven't?
We don't have baby doctors. Well,
We
I was
don't
a
have a
baby
baby
doctor, but that meant I delivered babies.
Oh, you were a baby doctor.
Or
indeed.
you take care of babies, but
No,
no.
I've had a few attorneys who they'll refer to
Okay.
new attorneys as baby lawyers.
As opposed to novice.
Hey, you guys, well, that doesn't sound good. But, you know, might miss that and
Yeah.
then just work directly on whatever the presenting reason
Yeah.
for them coming in.
Yeah.
And then this undiagnosed depression ends up being
Yeah.
a problem. So you will
Yeah.
always be certain of that. And again, for certain things like
Yeah.
that, I'll request them checking it out with their doctor first.
Yeah. It's
But other
interesting.
than that, no. What will happen with
Yeah.
hypnosis most of the time is you will either get something from it or you will get nothing, from it.
Okay. Okay.
But in great respect,
No harm
a lot
done.
of
No harm
people
done.
who do like guided meditations
Yeah.
or progressive relaxation and are calling it hypnosis. It's not really hypnosis.
Okay.
Hypnosis is something
Okay.
different. It's not exactly, it's not just about being relaxed.
Yeah.
You know, it's not just relaxing the muscles in the top
It's about
of your
accomplishing something while
head.
you're relaxed.
Yeah, yeah. It's about understanding things. We
Yeah.
are meaning-making creatures. We make meaning
Out of everything.
out of everything. That's what we do. And so the only thing that is unique about the hypnotic experience is that that is being done purposefully and strategically,
Sure.
and I'm acting somewhat as a
Guidance.
guide.
Yeah.
But the same system is being used.
Okay.
You know, our subconscious mind creates from a premise
Yeah.
into increasing complexity.
Yeah.
It tends to generate from a predominant focus of emotional attention,
Yeah.
and then it evolves
From
into
there.
increasing complexity.
Sure.
Deductively.
Sure.
And so, you know, everything that you can see
Yeah.
that within the stuff in this room
Yeah.
was ultimately an idea in some creative
Sure.
man or woman's head.
Sure. Sure.
So, you know,
Yeah.
it's not the big bugaboo that people think it is.
Right,
It
right,
really
right.
isn't.
And that's important because I think people have stereotypes, they have impressions, they have fears, or they have ideas that are only from what they've seen in the movies and things. And I think what we try to do with these videos is present reality and facts so that people can use the information any way they want.
Right.
My goal is for women to know what's out there and know that they can use it, but know also what to expect. It's about expectation. So,
Well,
you know,
let me talk about that a bit, because with hypnosis, when change occurs through this type of work,
Yeah.
it comes forth so spontaneously. In fact, it comes forth as a spontaneous expression of their behavior, because
Yeah.
it is them that's creating it,
Sure.
not me.
sure.
I don't give people suggestions.
Yeah.
I get people in touch with resources
Yeah.
that are suitable for them to make the change
Sure.
that they need to make.
And readiness is everything, right?
Everything, and then
Yeah.
they make the change.
Yeah.
It is not uncommon for me to work with someone, say, for a smoking cessation.
Uh-huh.
We finish the session.
They go out and have a cigarette.
No, some, I guess, you know, maybe. But
Probably.
they say, I don't think anything happened.
Yeah.
Okay. I was completely alert. Well, of course you were. I heard every word you said. Well, of course you did. Why don't you go home and I'll talk to you tomorrow when they come back in. How are you feeling? Good. You know, you seem like a nice enough guy. I was very relaxed. This was very pleasant. But I really don't ever think I was hypnotized. But you know, I went home and I got to thinking, it's just time I quit smoking.
Right.
And I
Right.
say, you're right. That's
Yeah.
exactly what you did.
That's right.
So the mistaken notion, the biggest
Yeah.
confusion is that I do anything.
That you're doing anything.
That I do something. I do something, but I'm not making anyone do anything.
Right.
You know, in fact,
They're doing it themselves.
occasionally.
Yeah.
Occasionally,
Yeah.
when someone is insistent upon that, I will take them here across to my window. I have this wonderful view. I think it's no longer called the Transco Tower. I don't know what it's called now. It used to be called the Transco Tower, and I'll point to the very top of that. And I said, do you see that room at the very top?
Yeah.
He said, yeah, the one with the, yeah, that one. I said, if I could make you do something, our office would be there, and this session would have been $20,000. I can't make you do anything.
Right.
What do you want?
Right.
What's
Yeah.
important
Big
to you about
difference.
it?
It's a big difference.
And I can help
Yeah.
you get in touch with that.
Now you have stress and you have anxiety. Is the hypnotic technique identical for the two, or is there something different? Obviously, most of them come hand in hand. Most of them are happen together. But let's say a person only has stress and they're not anxious about it. They're stressed, but they're just kind of almost dilapidated by it and worn out by it, and there is no anxiety. They're just stressed out. Or they're vice versa. They're anxious, but just by nature they're anxious and there is no stress in their lives. They just happen to be a very anxious person. Do you have a different approach, or is it really the same?
Well, that's a great question. If someone came in, usually I would screen this on the phone. If someone came in talking specifically about being anxious,
Yeah.
then that might be something that I might determine I should not see. I might
Oh.
refer that.
Oh.
You know, I might
Oh.
refer them to some cognitive behavioral therapy or maybe a psychiatrist, because
Yeah.
it could be social anxiety. It might be some type of, it could be something else. It could be physiological or something.
Yeah,
If it's just
absolutely.
anxiety,
Yeah.
but they're not stressed.
Yeah, because a lot of menopausal women say that they feel like anxiety is the most overriding feeling, emotion, or symptom that they have. They describe it as anxiety. I think they separate the concept of stress in terms of the social events going on in their lives. It's stressful to have an elderly parent that is not well and depending on you. It's stressful to have children who are still leaning on you and trying to go to college, and you're worried about paying for their education. It's stressful to have a marriage that is kind of rocky. They consider that stress, but they almost separate that as the circumstances, but what they feel
in their body,
what they feel in their body, what the word they use to describe much of what they're feeling is anxiety. And so that's why I'm asking about the separation of the terms, because I've heard them say that so much that I want to make sure that I relay that to you in terms of what you do.
They are, maybe just not describing it accurately.
Well, maybe not, but that's the way they see it. So we have to work with how people bring things to us.
Right.
I never substitute my assessment of something for my patients, because I believe she knows herself better than anyone else does. And so when I pay attention to what they say, I always use the same descriptive terms. And if they say anxiety, that's what they're feeling. Yeah. And so I just wonder if, if there's anything different about how you go about treating them, if they only have one or the other, or do you just use the same technique for both?
Well, each person is unique.
Yeah.
And you're using the word treat, and I guess
I know.
you could officially.
I can't help it. I'm a physician. I think treat.
Right, and I'm not. I mean, that is one of the distinctions. I'm not a psychotherapist. I'm not a psychologist, nor am I a physician.
Yeah.
So I don't treat. But in the course of listening to someone, initially on the phone, I can make a determination,
right,
as to what
what's
I think
really
might
going
be
on,
going on, and then I might suggest they come in, just visit with me before
Sure.
I might make a referral.
Sure.
But I'm trying to imagine in my own body what it's like if I feel anxious, if
Right.
compared to knowing what it is that I'm feeling stressful about.
Yeah.
Like having too much coffee or something.
Well, yeah,
I've had too much
and it's
coffee.
a symptom of feeling kind of on edge.
Yeah. That would be my thinking of what would be anxiety.
But you would be able to take care of a patient like that in terms of doing hypnosis with them and just seeing where it led them.
Well, what I might do a little differently with someone like that is to teach them some self-hypnosis techniques.
Oh, well, see, there you go.
Perhaps, the way this works, our subconscious mind connects things to things.
Sure.
Like me extending my hand to you,
Right.
knowing that, well, that means take it.
Yeah.
So what we would do would be to elicit a deep state of relaxation.
Yeah.
And then have them associate that state of relaxation with just some deep breathing, or perhaps holding their fingers together, and then just have them do that when they're feeling anxious to be relaxed. Now, stress management, working with someone directly for stress management, I would probably talk to them about, like the glass half filled.
Oh.
One person is upset because it's almost gone. The other person is thrilled because there's half left.
Yeah. Yeah.
You picture a football
perspective.
game. One person on one side, other person on the other side. One person scores a touchdown, everybody claps, everybody moans. It's the same thing.
Yeah. Exactly.
Depends on which side of the field you're on.
Exactly.
You're the physician. Our body kind of, stress is our body's non-specific response to a demand made upon it. We could go into shock or get extremely,
and there's all kinds of stress. There's physical, mental, emotional, social. There's all kinds of stress, right?
Can we go into shock, or just as easily from being given $10 million check as witnessing something horrible, right?
Probably.
Yeah, it depends on the circumstances. Jumping off of a bridge with a bungee cord tied to my leg does not sound like a good time.
Some people think it's fun.
Some people think it's fun. That's, some people would just be thrilled by that. To me, that would be
I
a
see.
fight or flight response.
Yeah. I
So,
Yeah.
maybe people who are real thrill seekers,
Yeah.
who
I
like
see.
to, race, down the side of a mountain on a ski. No thanks.
Now, if you have a person with stress and anxiety, how many sessions do they usually require before they feel like they have it, and I'll say under control? Because I think this isn't about curing or treating someone and getting rid of it. I think it's teaching them or getting them to a state of being able to feel like it's under control.
Yeah. One of the things that I say to people the first time they come in is you should consider this more about the acquisition of something than the stopping of doing something.
Okay.
Does that make sense?
Absolutely.
In other words,
It absolutely makes great sense.
Teaching a person
You got
how
it.
to be more relaxed.
You're giving them a tool.
Yeah.
Yeah.
Some people learn really quickly.
Okay.
For instance, if you happen to be the gifted, talented group, and these are the stories that you hear, people going, just so excited with regards to hypnosis. And it can be this quick with some people. You can see them one time, and
that's it.
They're done.
Wow.
And they really walk away from it just really, really, really thrilled with everything that they need. Usually with stress, 2 to 5 times.
And how frequently are those visits? Is
The
it
first couple of times, weekly.
weekly?
Yeah,
Okay, so
weekly.
yeah.
And then once I hear from the person that they are noticing that they're making some different choices, they're more relaxed. And by the way, these choices, these changes, sometimes are initially so subtle that their family members notice it before
they do,
notice it.
of course.
But once they begin to notice that, then we might skip the next session and then see them in 2 weeks.
Yeah.
And then, after they've learned it, then they've
That's
learned
great.
it.
Has anyone ever gotten worse? I mean, not because of
No.
hypnotherapy. That's a great thing to know too, because I think one of the things that I try to impart to my viewers is it's important to know benefits and risks, pros and cons. What is the downside? And I think most things have advantages and disadvantages. Almost everything has advantage. And I would think that the worst thing here is that it may not work.
Yeah,
But it's not like it's going to make you worse off, and it's not going to create a risk or another problem for you.
No.
So really, it's a matter of it doesn't hurt to try it. There's no harm in trying it. And the worst thing that can happen is that you don't respond and you go elsewhere and have some other kind of approach.
Right. Beyond
That's pretty cool.
Oftentimes the response is so subtle
Yeah.
that it takes a while for a person to really notice the benefits in their life anyway. So,
Yeah.
Yeah. I think, you have to be careful with anything that you do.
Absolutely.
When you begin, and just make certain that you're working within the area that you should be working.
And do you work in conjunction with some other healthcare providers?
I do occasionally.
Really?
I get referrals through the years from psychologists or psychotherapists. And, surprisingly,
And when you have a patient who, let's say you have a menopausal woman, she comes to you for stress and anxiety, but she says to you that it's her hot flashes that are causing most of her stress and anxiety. And you say to her, well, I can't take care of your hot flashes. I mean, that's not something that will likely respond here. And she says, well, okay, I'll go to my naturopath for that. Do you work with the naturopath in taking care of this patient's problems so that she can get the greatest benefit and take care of as many of her symptoms as possible?
I can't say I've had that come up.
Okay.
Although I have certainly had people come in to see me that have,
That have
that
another-
they're doing.
Okay.
I'm working with somebody else for this.
Yeah.
And seeing you for this part of it.
Yeah.
So
And that's perfectly, you think that's a good way for them to go. You
I
think
so.
that,
Yeah, I mean, in the occasions when I've worked with psychotherapists, who, by the way, may have no background at all with hypnosis.
Right.
It's very common that they don't.
Right. Yeah.
I would actually go to their office
good.
as a technician and do
good.
hypnosis at the first part of the session, and then I leave and then
Oh.
with the patient.
That's creative.
Yes, I've done that.
That's great.
In those areas it works really well. Or somebody has come in to see me before, in the course of me doing the consultation, I'll tell them this is not the time for me to be involved.
Yeah.
And then I'll make a referral.
Okay.
After you've done this,
Yeah.
and then talk to them about perhaps coming to see me at the end of it all.
Okay.
So yeah, through the years, I
Yeah.
mean, I've had some referrals from some very unusual directions. I would have
I'm
to
sure.
think about
I am
them.
sure you
I mean,
have.
I've been doing this for 36 years.
Yeah.
So
Yeah.
I've been around.
Have you ever been hypnotized yourself?
Oh yeah.
Yeah?
Oh yeah. In
For
fact,
for anything in particular?
well, I was hypnotized once on stage at the Lubbock State Fair the summer that Elvis died.
Well, it says a lot if you will, quote, take your own medicine.
I will.
It says a lot for it.
That's right. Take your medicine.
Thank you so much for doing this. I can assure you that there are so many women out there who may never have even thought much about hypnosis as an option, and I have mentioned it in my tutorials to them, but I don't know what you know. And what I like to do is bring the source to my viewers, and that way they can see for themselves what's possible. And I just try to ask the questions that I think they would want to know, and I think you've done a great job of explaining to them and me everything that you
You're
do.
welcome. Are we already done? I thought we just got
So
started.
we already done. I think we've done a great job. Follow me on my social media, Facebook, Instagram, Twitter. Leave me comments, ask your questions. I love helping you in any way that I can. So keep in touch, and I'll see you later. Bye.